Habari za asubuhi. Good morning. Bwana asifiwe. Mbona mjibu jamani? Okay. Karibuni sana kwenye forum yetu. Forum hii imeandaliwa na Amplify Health and Development in Africa. Na we are going to discuss about climate and health in general. So I would like to hand over the mic to moderator Mr. Isaac, who will be moderating the sessions. Karibu sana Isaac.
Hello, good morning. Habari za asubuhi. So we are so happy to be joined by you in this session. My name is Isaac from AHD, and I'll be setting the stage as we are looking forward to start our forum. So quickly, I'll take you through a short presentation of what AHD is. Maybe I should stand here. So AHD stands for Amplify Health and Development in Africa. It's established and registered under NGO Act, and we were registered in 2023, but we started being operational in 2024. So it's youth-led, and our objectives are 3, which also go along with our thematic areas, that is addressing impact of climate change on health. Can you go back, please? Meaningful youth engagement, that is community engagement, and health system strengthening. So these are 3 thematic areas, that is climate and health, community engagement, and health system strengthening. And we use 3 approaches, that is data-driven advocacy, storytelling, community action, and strategic communication. So this is the summary of our key achievements since we started being operational in 2024. So we are doing community health workers training and capacity building, and we did training and equipped health workers from 10 wards in southern region, particularly in Mtama district, which is in Lindi region. And also we published and distributed storybooks, and these were storybooks on malaria control, the community action on malaria control. And also we hosted interactive webinars with youth experts across Africa and Commonwealth, focusing on the roles of youth in response to climate challenges. And also in the health system strengthening, we did diagnostic support in southern region. We also did this in Lindi region, where we equipped the health facilities with diagnostic equipments on malaria. So on advocacy and global engagement, we profiled the impact of climate change at Forecasting Health Future Summit, which happened last year in Azerbaijan, Baku, and also this year in Brazil. These are short videos showing a story of how young people and women are bringing about impact with regards to the impacts of climate change on health. And also we hosted a climate change and health forum last year, our first climate change and health forum, and this is second one at margin of Tanzania Health Summit, where we engaged over 400 stakeholders. And also in the youth engagement part, we trained 45 youth from 5 universities, our initiative, namely Uni2Kita. As you see back there, we have a banner for that initiative. It's Uni2Kita, and we are intending to equip young people with digital skills, peer support, and mental health support as they are moving out of colleges back to streets. So in the research and community-led solutions, we conducted community dialogues and questionnaire surveys, as well as FGDs with CHWs and women and young people, to co-create solutions addressing infectious diseases, particularly with focus on, we focused on NTDs and malaria, and we started consultative webinars from April. Every month we had a webinar on climate and health, and we did this with Commonwealth Youth Network. So we have Jamii Shupavu. we have a banner there, but it is obscured and unfortunately with a podium. This is the initiative that we launched last year. Jamii Shupavu is a Swahili phrase for a resilient community, and we intend to address the health implications, which are the impacts of climate on health. We focus on vector-borne diseases, mental health, waterborne diseases, food insecurity, physical injuries, socio-economic implications, as well as environmental implications. And, okay, back to research slide. Climate health and research. So as with our partners, Population Council, we have an ongoing project where we are conducting study of seeing the role of youth and CHWs in addressing the health impacts of climate change. So we did FGDs and surveys, as I've said earlier. Next, please. Okay, so having said that, I welcome you all in our second Climate and Health Forum. And this time I would like to invite Alois Urasa, who will be moderating this session. Karibu sana, Alois.
So good morning. Good morning. Good morning. So thank you very much, and once again welcome to this forum where we'll be in the next few minutes we'll be discussing on the impact of climate on health, building on the different recommendations that came out of the previous summit that we hosted in Zanzibar, as Isaac shared, and building on the activities and insights that we have had from young people, from community health workers, from women, and we'll be joined here with a panel of distinguished speakers who are doing different activities from different communities, but later on we'll be hearing from some of the key stakeholders in this area on climate and health. We are joined here with a number of partners. I don't know if I'm displaying the correct thing. We are joined here with a number of partners who are also doing the same thing. We'll hear from the speakers who are also coming from different organizations that are taking action at the community level. And we also have IOM, UN Migration Community present with us. I'm not sure who is. Thank you for being on the table. We have Save the Children. We have UNDP. I'm not sure if they're already in the room. We have AMREF South Africa in the room. We have Tanzania Health Summit, our host. Oh, sure, Arnold, I see he's active as usual. Women Fund. All right, thank you. Jakaya Mrisho Kikwete Foundation and Women in Recycling, but we also have more other organizations on the panel. So we have the QR code to scan. I think they'll be displayed through your tables to register for this and also to keep in line with the communication and different activities and events that we'll be hosting, including a series of events and webinars that we have had throughout the year in partnership with Commonwealth, that we normally bring different countries, young people, young experts, and many other senior experts to have intergenerational dialogues to discuss on the impact of climate, share best practices, insights from different countries, and so on and so forth. Why is it important that we are discussing about climate and health? I think it's not just a matter of our schools of thoughts or emotions or interests, but more looking at the realities that we are facing in the world. And recently, as most of you, I'm sure you'll be following up with different high-level or global health initiatives, you must have heard on what one of the very senior leaders in the world commented about climate change, claiming that it is one of the scams. But we who live in the communities, I think, know better. We who really have faced the impacts, women, youth, children, and everyone in the community, we have really seen the impact, and we can testify. It's not just a matter of emotions, as I said, not matter of our schools of thought, but it's a fact and a reality that we are really facing in the community. So having this forum is part of raising more awareness, but also bringing us together, have that shared and common understanding, and paving a way forward, but as well as sharing the best practices and examples of how we are responding. Before I go further, I'll ask my team to play a short video to set up the scene for why should women be engaged and why do we have this forum, just for a few minutes, and then I'll call my panelists to the stage.
Climate change extends beyond its environmental impact, posing a significant threat to human health as well. In Tanzania, the effects of climate change are being felt in various ways. In response to these challenges, women have been taking on leadership roles as change makers, developing different strategies and initiatives to address the threats posed by climate change.
Climate change is more than the changes in weather patterns. It's about the frustration of families who have lost their family members due to floods or have lost their houses. It's about the worry of a farmer to secure food for their children due to the unpredictable weather patterns which has caused the loss of their crops. It's much more deeper about adding an extra mile for women in search of water sources due to the droughts resulting to scarcity of waters.
Dr. Mary Nicholas is a distinguished medical doctor and a dedicated community health specialist, currently serving as the head of programs at the Amplify Health and Development in Africa, AHD. With a great passion for promoting community health, she has devoted her career to empowering and training community health workers to effectively address health challenges posed by climate change.
Together with my team at HDA, I've been taking lead on climate health nexus initiatives such as Jamii Shupavu. Jamii Shupavu is a Swahili phrase which means resilient communities. We aim at creating resilience in communities and health systems through empowering and training of community health workers with climate change education, mitigations and adaptations plan, as well as empowering them with resources such as bicycles, which assist them with the movement from one place to another while they are conducting their work. Community health workers have been working at household levels, ensuring implementation of health initiatives as well as dissemination of education. So empowering them ensures sustainability of the project as well as climate change education and cultivation. Women and community health workers play a vital role in the fight against climate change and its health impacts. As caregivers and educators, they can make a real difference, but they still lack proper knowledge, support, and resources. Therefore, I call upon policymakers and stakeholders to invest in and empower them with training and leadership opportunities to build resilience and ensure a healthy future for all. The time to act is now.
Thank you very much. So the time to act is now, and what kind of actions that are really happening in the communities, and what should we hear today? What insights do you have in terms of what kind of actions, as Dr. Mary ended, that the time of action is now? What kind of action that is already present in the community? I remember last year someone from the audience really emphasized on the need to promote local solutions and local initiatives on addressing the impact of climate. Now I'll be joined here with panelists, and I'll call to the stage. And just for your information, we'll be mixing both Swahili and English to accommodate the audience, but also to accommodate the speakers that we have. Leo tuna wazungumzaji kutoka kwenye nafasi mbalimbali kama theme yetu inavyosema, vijana, wanawake na wahudumu wa afya ngazi ya jamii, na tuna mhudumu wa afya ngazi ya jamii, community health worker joined us from Kyerwa. I think some of you, if you were in the community health workers forum yesterday, you heard from him from different insights that he has. Nelson Francis Edward is a volunteer community health worker with MDH in Kyerwa district in Kagera, served some of Tanzania's most remote and underserved mountain villages, walking or cycling 10 km plus daily. He delivers vaccines, maternal care, and health education to over 40,000 people across Bugoroma ward. He translates health guidelines into vernacular languages, ensuring marginalized communities understand and access services. Nelson has mobilized families to embrace vaccination, sanitation, and family planning, reducing stigma around HIV/AIDS and maternal deaths. As district CHW secretary, he co-founded Hedoso NGO, supporting orphans and people with disabilities, providing grassroots dedication to transform community health. Karibu sana Nelson kwenye stage, and would really love to hear from you. Clap hands for Nelson, please. Again, I'm joined with another powerful young lady in the room, Maria Daudi Joseph. Maria Daudi Joseph is a project manager at Women in Recycling Foundation, a Tanzania-based organization dedicated to empowering women through sustainable waste management and circular economy initiatives. In her role, Maria leads planning, execution, and evaluation of key programs aimed at enhancing women's participation in recycling, climate resilient, and environmental sustainability. Maria is passionate about inclusive innovation, climate action, fostering economic independence through sustainability. And most interestingly, few days ago, Maria won an award through our organization on blue economy. She will tell us why the economy is colored later on the stage. So, Maria, you're welcome, and congratulations. Clap your hands for Maria, please. Again, we are joined by Dr. Faraja Chiwanga, an internal medicine physician. So if you have any problem, you can consult her for free, only for today. Clinical endocrinologist and Director of Medical Service at Muhimbili National Hospital, Tanzania. She's a honorary lecturer at MUAS, an honorary senior researcher at University of Oxford, and a doctoral researcher at Uppsala University's Complex Intervention Research in Health Care and Care Group. Her research addresses non-communicable diseases in health and the health impacts of climate, with a focus of nature-based solutions for adapting and mitigating. She leads a Wellcome Trust-funded project on reducing extreme heat-related risk among agricultural workers in Tanzania. Put your hands as we welcome Dr. Faraja to the stage. Last but not least, Dr. Joseph Komihangiro, a Senior Country Director for Pathfinder International. He is a Kofi Annan Global Health Leadership Fellow and Commonwealth Professional Fellow in International Mother and Child Health. He currently serves as the Senior Country Director for Tanzania and Regional Portfolio Director for East, South, and Horn of Africa at Pathfinder International. He has over 23 years of experience, some of you it's your age or even more, in international health and development, including 15 in senior leadership and international NGOs. His areas of interest includes sexual reproductive health and rights, maternal neonatal, child or newborn child and child health, system strengthening, health diplomacy, policy advocacy, amongst many other portfolios. He oversees programs in Kenya, Burundi, Tanzania, Uganda, Ethiopia, and Mozambique. Dr. Joseph, we welcome you to the stage, and we would really love to hear from your rich experience of the ages of many of us in the room in terms of how climate has really been impacting our lives in the last 2 decades. Brothers and sisters, you're welcome. Excellent, distinguished guests, you're welcome to this discussion. We'll only have a few minutes with our panelists, and we'll want you to speak more. So prepare your questions, prepare your comments. That we'll really love to hear from you. Asanteni na karibuni sana. My panelists, feel free to speak both either Swahili and English, or if you can speak Kiswanglish for the audience to really get the conversation and engage. Are we ready to listen to them? Are we ready? Asanteni. So, as I said, on the video she ended with it's a time for action now. Ni muda wa kuchukua hatua sasa. Nelson, unafanya kazi na unasafiri umbali mrefu, wakati mwingine na baiskeli, kufikia nyumba nyingi, kupeleka huduma za afya, counseling za masuala ya HIV AIDS na mengine mengi, lakini pia umeanzisha taasisi kule Kyerwa. Ni jinsi gani mabadiliko ya tabia nchi yanaathiri utendaji wa wahudumu wa afya ngazi ya jamii, na ni nini mnafanya ili kukabiliana na hizo kwa kazi mnazofanya? Karibu.
Asante sana. Kama nilivyotambulishwa, kwa majina ni Nelson Francisco Edward, natokea wilaya ya Kyerwa, mkoa wa Kagera, kata ya Budomora. Tunaona kwamba mabadiliko ya tabia ya nchi yanasababishwa na shughuli zetu sisi kama wanajamii za kiuchumi na masuala ya kilimo, pamoja na ufugaji holela na ukataji miti ovyo, ambapo tunaona kwamba katika suala la ufugaji holela unajikuta kwamba ng'ombe mmoja ana uwezekano wa kula miti milioni 1 siku moja, jambo ambalo linaweza ikasababisha mmomonyoko wa udongo, ukame na kusababisha madhara makubwa sana kama vile kuvuruga mifumo ya chakula, ambayo inaweza ikasababisha watu kupata njaa. Na njaa inavyotokea, tunaelewa kwamba inaweza ikasababisha ulemavu wa watoto wakapata utapiamlo. Hiyo tayari ni changamoto kubwa kwenye jamii. Hivyo sisi kama wahudumu wa afya ngazi ya jamii tumekuwa tukielimisha sana, tukielimisha watu kupanda miti ili kurudisha uoto wa asili. Basi katika hilo tumeweza kufanikisha, kwa mfano kama kwenye wilaya yetu ya Kyerwa, nimeweza kuhamasisha wahudumu wa afya ngazi ya jamii wote kupanda miti ya matunda na miti ya vivuli katika vituo vyote vya kutolea huduma za afya, na tumeweza kufanikisha zoezi hilo kwa asilimia zote. Lakini vile pia tumeweza kuweka mikakati ya kuweza kupambana na swala la mabadiliko ya tabia ya nchi. Moja, tunaendelea kuelimisha jamii kupanda miti, lakini vile pia tunaendelea kuhamasisha amani kwenye jamii. Kwa mfano, kama tunavyoelewa, mwaka 1945 kulitokea machafuko ya kisiasa kule Hiroshima na Nagasaki, ikapigwa bomu inaitwa atomic bomb, ambayo ilisababisha mabadiliko makubwa sana ya tabia ya nchi, mpaka kiasi hiki kwa siku ya leo ukienda kule kuna madhara makubwa yanatokea. Mpaka leo kuna watoto wanazaliwa na changamoto za vichwa vikubwa, microcephalus and hydrocephalus. Hivyo katika jamii tunaendelea kuhamasisha amani, lakini pia tunaendelea kuhamasisha uwepo wa miundombinu bora ya viwanda, ambapo tunaona kwamba tulikuwa na changamoto ya viwanda wakati mwingine vinatiririsha maji taka, ambayo wakati mwingine yanatiririka mpaka kwenye vyanzo vya maji, na yanavyotiririka kwenye vyanzo vya maji pale tunakutana na changamoto ya inasababisha afya mbaya ya samaki, ambapo tunajua kwamba samaki ni kitoweo cha jamii. Basi kwa hiyo machache nirejesha.
Asante sana. Can you clap hands for Nelson, please? Even if you didn't understand, you can clap and I'll translate briefly what Nelson has shared. Maybe I'll translate a few things. That Nelson has worked with the community health workers, understanding that we are the ones, human beings are mostly responsible for the climate change impacts in the communities, including activities that we do around agriculture, livestock keeping, and so on and so forth. So he has mobilized all the community health workers in his area to plant trees in every facility that provides care, health care. So, and they have succeeded with that 100%. He also urges us to consider issues around peacekeeping, citing things like which have happened in the past years in Japan, that those are areas also which could be impacted with climate change, which could be more fueled with climate change. But also he urges on the importance of proper farming and agricultural practices, and maybe I'll add that supporting more initiatives that community health workers are doing on the ground. I now want to pass to hear some perspectives from the young people and women in recycling. Youth engagement is really critical, I would say, given the population that we have currently, that over 65% of the population is of young people, as I'll say, in Africa, and there is real need to tap into the potential of these young people in terms of addressing the impact of climate, to secure, to safeguard the current and the next generation. We know that Arena Recycling and Women in Recycling are sister organizations that are really working around recycling, using waste to make some bricks and amongst others, but also highly involved in the blue economy. I don't know what it means with blue, and the colors of the energy, the blue, green energy, I don't know whatever you call. So Maria, will you share with us more about the work that you're doing and why is it important for young people to engage? And before that, I just want to appreciate a few young people in this room. The four winners, first the four winners who contributed to the challenge on climate and health impact. If you're in the room, could you stand? The four winners on climate and health, we have two here, we have one there. All right, clap hands for them, please. We had over 100 people, young people who submitted their comments on what are the impacts of climate and health, and we had top four winners who really built up great insights. So young people like this and others who are seated here, there are many young people in the room, including all members of AHD, are all young people, all under 30. So why is it important for us to be in these spaces?
Okay. Good morning, everyone. So my name is Maria Daudi, a project manager of Women Recycling Foundation, but also a co-founder of Arena Recycling. So first I would like to share what we have been doing as WORF. So WORF is an organization that basically deals with empowering women through recycling activities. And WORF comes from the Arena company, which deals with recycling plastic waste into eco-friendly building material. So we are making bricks out of plastic, which somehow it helped to address the issue of plastic pollution in our environment, but also we are trying to reduce the construction costs. So coming back to the WORF, we decided to come with this initiative after sewing the gap of women in waste management. Recycling is a business now worldwide, but women somehow are not part of it. So we come with this organization to make sure that women are the main actor of waste management traditionally see opportunity or benefit from the opportunity of waste management. So this initiative aims at provide awareness to women to saw the opportunity that are in waste. And speaking of waste, we are focusing on plastic waste, but also we are focusing on food waste, glass waste, and any other waste that can be recycled and be reused. And so far so good, we have been able to work with more than 102 women in Temeke, and we decided to choose the community of Temeke since Temeke has high population and it has been affected with many social problems. So introducing this opportunity for them help them to increase their income, because most of the families in Temeke end up to $2 per day. So through this opportunity of recycling and making sure that they gain something from waste, it helped to improve their economy from where we are to where they are right now. And speaking of what this initiative impact youth, recycling is a business, as I said, and most of people are benefit from it. And speaking of people, we are focusing on the waste pickers that we saw in the street. We may see them as crazy or somehow that, or some people that don't know what they are doing, but they have a great impact on the environment. Just take a picture a day without a waste picker in the street. They will be full of trash, full of plastic everywhere. So they have a big role to play in protecting the environment, but somehow they are left behind. They are not considered. And most of the community are taking climate change as a responsibility of government, responsibility of organization, but it is our all responsibility, because if any individual take part on making sure that the environment is clear, it be also a very good opportunity to make sure that we protect the environment. And referring to what my fellow panel spoke, about his initiative on addressing the issue of cutting trees. We can't say we're addressing these issues if we left youth behind, because the youth are the one cutting those trees to make money. They are cutting trees so that they can sell charcoals to benefit from themselves. So if we improve, or if we put more effort on impacting these youth on how they can come with a solution, while they are making benefit from the source, natural resources that we have, they can also making sure that they come up with a solution on how to preserve it for the future generation that we are going to have. So there is a lot of opportunity in climate change, especially in recycling, and we also need to make sure that we are not benefiting only ourselves for this opportunity, but we pass it around to the youth in the street, but also we pass it around to the women, since they are the one managing waste starting at home. So we want to shift them from doing it traditionally to make it as economic perspective, so they can gain something from recycling or from waste.
All right, thank you. Thank you. Thank you very much. Can you clap hands for Arena? So from business, they started Arena as a business, and then they saw the importance of women and started Women in Recycling Foundation that is helping more women to engage, build more businesses out of it. And it's one of the really practical young people, young organizations that I've seen in the country. There are a number of them, but it's among the best that I've seen, and they have really been recognized with a number of partners, and I hope they'll keep growing and sustaining their momentum. Thank you very much for the insights, and I hope you all agree that young people, we are important in these spaces. Do you? Do you agree? It's the young people who are responding. I want our seniors to see. Okay, thank you very much. Dr. Faraja, we have heard from community health workers, from young people. You are a medical doctor with tough terminologies like endocrinology. You are a mother, you are a researcher. Why did you decide to engage in these climate matters, and why is things like land restoration important for people's health? And where, I'm asking many questions as I know, and where do you see the focus of research on climate and health taking us going forward, and in terms of also advancing our livelihoods and building resilient communities?
Thank you. Thank you very much, and good morning again, everyone. As I've been introduced, I'm a doctor, and I get those questions most of the time, what am I doing in climate change? But as you've already heard from the two speakers, we cannot separate health from the effect of climate change. Now, there are two issues here. One is for us as medical professionals to understand that first, climate change is real, and second, it affects health, both directly and indirectly. But the other important thing is that the health angle can be used as a very powerful tool for advocacy. When you talk about climate change mitigation and adaptation, sometimes it does not resonate well when you talk about raised in 1 degree temperature or 1.5 above Paris Agreement, or raise in sea level. But when you talk about directly health, this will affect this will affect mental health, and you can show that evidence. It's also a very powerful tool. Now, I've been answering them in not the order that you asked, but this is one of the most important things that we embarked on looking at the intersections, but also scaling up interventions. In climate change, there are adaptation and mitigation. Both of them are equally important. For some of you who have attended international organizations, sometimes they try to sway us so that we go more into mitigation. But for countries like Africa, for example, where we are not emitting as much as the Western countries, but also we are bearing the burden of climate change effects, we cannot avoid talking about adaptation. Adaptation, it means we already have problems. How do we adapt to the problems? Now, we can see increased temperatures, for example, the area that I'm working on, but also we see flooding, for example. And then there are vulnerable population. You have talked about women, for example. They are the gatekeepers, but on top of that, they are the ones that are bearing the burden because they are the ones that are seeing the effect firsthand. Even droughts, because of prolonged droughts, for example, when it comes to food shortages, they will be the one getting that stress firsthand. In the area where I'm coming from, and I'm not going to say where, you will find in times where there's drought, the men are not in the houses. They will go somewhere until that period ends, you know, when there's food shortage. They will say they are going to look for food, but sometimes it's because of the stress at home. But the mother will always be there, and now you can know the burden that they are taking. So they are forefront in making sure that the family keeps afloat. Now, because of that, they are very good advocates also for climate change adaptation interventions. When you go for restoration activities that we are doing in central Tanzania, we have been advocating for what we call nature-based solutions, especially the ones that are accessible to the community. For example, tree planting it works, but it's probably not as effective in arid or semi-arid areas, so that we look at other, I think somebody talked about community, you talked about it, you know, accessible solutions that can be accessed by the community. So we train what we call climate smart agriculture, and you see that women are at forefront. So in the many aspects that we are going to talk about when we look at climate change and health, we should look at it on these two sides that I've been speaking about. One is making sure that we understand that it affects health, both indirectly and directly. But we should also understand that we need evidence in terms of research so that we can use it as a tool to advocate for mitigation measures, intervention, and inform policy for interventions. And for the healthcare aspects, we look at interventions that have health co-benefits, that will also maximize health benefits on top of addressing issues of climate change. Thank you.
Thank you very much, Dr. Faraja. I had to drink water because I asked myself a very tough question. First, you said we need to get evidence, but also, where do men go when there is too much stress in their houses? Where do they go? Maybe we are busy building up new strategies to feed our families. Maybe, yeah. So thank you very much, Dr. Faraja, for setting up that discussion and linking up why you still emphasizing why women are really important in these spaces to engage. Dr. Joseph, you're a father, maybe you'll answer the question of where do men go. But I have two major questions for you, very simple ones, by the way. We have looked at many different initiatives, even here in Tanzania. There are so many organizations doing different things in the name of climate and health, in the name of climate adaptation, climate resilience, and everything. But how do we set the best model to respond to these issues? I know Pathfinder International, you have done a couple of issues, but then our theme has a word there, equity. While addressing these issues, how do we sustain and ensure equity in response?
Asante sana, Mr. Urasa. Good morning, everyone. It's very beautiful to sit here, you know, especially surrounded by young people. I'm very excited to see the succession plan in action. Yeah, Dr. Faraja, mimi nakufahamu, but maybe wewe unifahamu, lakini mimi nakufahamu. Na mimi ni daktari, I'm also a medical doctor, but I stopped working in the clinical setup way back in 2003. And that's why this guy was saying that mzee, kwa sababu some people were not born in 2003 in this room, yeah. So I work for Pathfinder, and you know, Pathfinder has been working in Tanzania since 1957, you know, even before our country got independence. Some of you maybe already know that Pathfinder was the organization which established the Tanganyika Family Planning Association and the Zanzibar Family Planning Association in 1957, and that later translated into UMATI, and then later translated into the Reproductive and Child Health section of the Ministry of Health. And Pathfinder coming to the topic of community health workers, Pathfinder established the first community-based distribution of family planning programs in Tanzania way back in 1970s. So we have been here focusing on sexual reproductive health services all along. Currently, our work focuses on 4 pathways, as we call them. Pathway number 1 is sexual and reproductive health services. That is a broader one, including maternal, newborn, and child health and adolescent health. The second pathway is looking at health system strengthening. The third pathway is looking at climate and health. And the fourth pathway is looking at women economic empowerment and leadership. So I would also like to start by saying that we started venturing into climate and health interventions about 12 years ago. And at that time there was little knowledge on what can be done when it comes to climate and health. And actually that was the time when the evolution of people talking about the climate and health and the nexus was evolving. Some of you may recall in 2000 there was a lady in Mozambique who was pregnant and the community was hit by floods. And that lady, to save her life, she climbed on a tree and then she delivered a baby on the tree. Do you guys remember that? It was breaking news on CNN and BBC. It was one of the areas which is very much referenced when we start talking about the impact of climate on health, and particularly when we talk about sexual and reproductive health services. So at Pathfinder, we started calling our interventions population, health, and environment interventions. And we are looking at how we can integrate knowledge and actions which will do good for the population, for the environment, and the people who are relying on those ecosystems. So Dr. Faraga mentioned a bit about mitigation and adaptation. And our work is mainly focused on adaptation for good reasons, as the doctor has said. But also some of the work we do has some elements on mitigation, though not our main focus, but of course we contribute. During our years of work, on climate and health interventions, we have learned that, when we go to the communities, the challenges and the problems faced by people in the community, they are very integrated. So when you attempt to solve one of the problems, you kind of create a need to solve another problem. So you go in focusing on family planning, then you realize that there is HIV and AIDS, and then you realize there is malaria. Then you realize there is food insecurity. Then you realize that there is no education for children. So when you are working at community level, you find that, when you go with a single sector approach, vertical programs, your programs will be missing something. And that's why when Pathfinder focuses on climate and health issues, we go in using a social development model, a more holistic model, realizing that we cannot do everything, and because of that we forge partnership with other organizations that can complement our work. Now coming more on what actions do we take, at community level, we focus on household. So in the community, we take household as the basic unit of influencing the behaviors and stimulating actions. We call these climate smart behaviors and the climate smart actions. And climate smart actions and behaviors, there are many. They range from one sector to the other. As I said, that climate is a multi-sectoral issue. So there are behaviors and actions around health and sanitation and wash. There are behaviors around, nature-based solutions or focusing on environment and restoration and biodiversity conservation. There are behaviors looking at ecological energy. There are behaviors looking at food security, environmental friendly income generation activities, climate smart agriculture, and so on and so on. Now, when you look at all these behaviors, we created a set of indicators or a set of actions. There are about 30. They vary, they go up, they go down, depending on the landscape where we work, And we say, if a household can achieve at least 75% of certain behaviors or can implement 75% of these actions, then we say this is a model household for climate resilience. Are you following? And if in a community there are, let's say, 100 households, and 75% of the households adapt to some of these climate smart actions and the climate smart behaviors, then we say this community is a model resilient community against climate change. And so on and so on. So in the community there, if there are institutions, let's say if you're in a village and in a village there is a school, then there are actions which we take at the school to make sure that that school is also behaving in a climate smart way. And at the schools we establish what we call population health and environment school clubs. If there is a facility, a health facility in the community there, then we support those health facilities to become green and inclusive health facilities. Because remember, the health facilities are also emitting, you know. So if health facilities can stop using generators, for example, and if they can start managing their medical waste using solar energy, you know, solar powered incinerators, and if they can operate using solar energy to operate maybe in the operating theater and so on, if they can harvest water, if they can plant trees in the surroundings, and if healthcare workers can be climate smart, you know, climate aware, and the planning of the health facilities is taking into consideration the changing of weather pattern, the forecasting of medicines and so on, then those health facilities become also climate smart. So that's how we look at, you know, a social development model, making sure that we don't leave any sector behind. Now, Pathfinder cannot do everything. So we end up inviting partners who have specializations in different sectors to complement the work. There are people who are very smart and experienced in solar energy, you know. Then they come and join our efforts to be able to do that work. Of course, the government is our main partner in those areas where we work. So we leverage a lot government initiatives, but also doing a lot of influencing at the government level to make sure that whatever we are doing is aligned with the government policies and is also complementing government efforts. We realize very clearly that, you know, the impact of climate change is gendered. It's not gender neutral, you know. And we all know that women bear more burden, like what my colleague here, doctor, has said. So because of that, Pathfinder puts women at the center of our climate resilience work. And that's why we call it women-led climate resilience. And we make sure that much as we do everything, but also we ensure that women have access and can utilize sexual and reproductive health services in a way which is accessible, cost-effective, and friendly to their needs. You know, and when I'm using the word friendly, I'm taking care of needs of different women, because women are not homogeneous. Some women are living with disabilities. Some women are very young girls, young women. They have different needs. So to make sure that our services are inclusive and can cater for the needs of different groups in the area. Now, to summarize, I will not stop speaking before I mention the work of community health workers, because at the community level, our main workforce is the community health workers. People like my colleague here from Kierwa, you know. These guys, they receive training, they become community and health champions at community level. They learn about the behaviors we are looking at promoting and influencing, and then they visit household, they educate community members, they collect data, they disseminate information, and make sure that they're making follow-up to make sure that people are not going backwards. You know, today we may have a latrine, and then tomorrow we don't have it anymore. So today we are a model household, next month you are not a model household anymore. So the community health workers help in terms of making sure that there is sustainability of those climate smart behaviors at household level. And again, depending on the landscape where you work, if you are closer to a lake, then some of the climate smart behaviors will focus on protecting that lake, you know. If you are living near a forest, then some of the climate smart behaviors will focusing on conserving that forest, you know. If you are living in mountainous areas, of course, some of the climate smart actions will focus on climate smart agriculture, make sure that you can use terrestrial land properly. If you are living in the Maasai land where we focus on livestock, of course, some of the climate smart actions will be focusing on livestock and how you can maintain harmony between the farmers and the pastoralists. So I will stop here, and if there is any follow-up question, I will be happy to address. Asante sana.
Tupige makofi kwa shule nzuri. Thank you very much, Dr. Joseph. You didn't only answer the question of how can we set up the model, but also give us examples of the model. How do we build climate resilient models from the very lower level, from the household level? Now we were supposed to be already in this Q&A session, and we expected to have up to 6 questions, but I'll limit to 4 questions. If you have a question, a comment, contribution, it's your time now. As I said, our speakers will only set us in. They're not speaking much, only giving examples and leading us to the discussion. So if you have any question, please put your hand, and we have one. We have start there, one. Here. We have 2. Oh, we have a student here, our young lady. Okay, then 3, I hope they see. Okay, you have the mic.
Okay, thank you. My name is Gaspari Misumbi from MAMREF. Mine goes to Maria. Just wanted to understand if there are any challenges, can be maybe personal or institutional, that are facing during implementation of this recycling industry. Because you took us through the narration on how you are implementing the model, but you didn't explicitly say main challenges that are being faced during the implementation of your recycling model. Thank you.
Yeah, thank you. We'll take the questions and then we'll answer later. So I think the second one was there, and then there is 3rd and 4th here. Maybe we'll have 5 more minutes, and we'll add a few more questions.
Thank you.
We'll have interactions. Yes.
Thank you. I would like to congratulate everyone who presented. It's really a good kind of the presentation. But my questions goes to the last presenter. First, I appreciate the effort you put on addressing the climate issue. Actually, I'm happy that you try to cover all key aspects which we needed to take to address the climate impact and mitigation issues. My question is, how you talk about the smart behavior and smart actions, and you also link it into the context of the particular area. So I just want to know, how are you being able to identify those smart actions needed in particular context, and do you engage like in training those local people, community level, that you have some kind of the education phase to identify those smart actions and smart behavior, so that you try to educate them or to let them be improved. But one thing which I learned from you today, that the climate issue is not only one thing. I really appreciate the way you have broadened it to see that it's work like a systems, and when we want to tackle the challenge associated with these impacts, we need to address the whole entire system. So that's the good insight, I think, for everyone, that we should not address only one component. When you deal with the health, you will find again there are other areas which are affected with the same. But maybe the last, if I could get the view from you again about how do we go about when we have this global power, which they are still stating to see that the climate is the real issue. Recently, during the General UN Assembly, we heard Trump saying that this going green is a fake issue. And if we go, we are going to decline our economy, different countries' economy. So in the middle of this big effort globally, how are we responding and acting on this? Thank you.
Thank you. There's a question here, I think.
My name is Dr. Ali Mzige. I would like everybody to say my community, my university. Please say so. In the approach, you need to use 2 CIAs, not that from America, but we've got to give correct information and advice. CIA, you have also to make sure that you become creative, innovative approaches. The only thing we miss in this country is PMC, preventive medical care. You started with the health information, health education, and health promotion. It starts from home. My mother delivered 10 children. I'm the third born. None had a neurotube defect. We are all clear and we came up as we are. This means my community, my university. If we don't have ideas to push on forward, the problem we have here now is one thing. Do we keep this in stock? Do we get this to our community? That is very, very important. And for information, I've written a book, Afya Yako ni Mali Yako Itunze. I can produce maybe 100 copies tomorrow. If you're going to retire like me, it's now 20 years since I did my retirement. I'm still alive and well, thank God. No alcohol, no smoking. But my grandchildren are taking energy drink. What do you expect? And so many other things. So to cut that story short, tomorrow there will be a sale of a book called Afya Yako ni Mali Yako Itunze. The first chapter will be Sera au Afya Wazee na Uzee, ambayo in this country hatuna a geriatric medicine. And then one thing I must tell you, especially people from the Ministry of Health, you need to have a physiotherapist in every district hospital. There are so many people who are having stroke and we've got to move. How can you move from this hospital to a regional hospital? Mimi nasema kupanga ni kuchagua, lakini physiotherapy is the best. Imeokoa maisha wazee 10 walikuwa na stroke, now they are able to walk. Thank you.
Thank you very much. I'll ask this question, what is CIA later on?
Correct information and advice.
Thank you very much, Mzee Wazee and Yazina, and that was really insightful. Thank you. We have another one.
Good morning. I'm really thankful to be here today morning. My questions are directly related to worth and path direction. You say that you meet with various people, and when we come to worth, you meet with women, and you meet them from various societies, from various levels, and you train them. But when we come to training, it's not that easy, isn't it? You may find people, a group of people, but when we come to a certain perspective, it's not like everyone will be able to adapt it in an earlier form. So how do you train people? In what time frame? Like, how does it take? How much time does it take for them to adapt to the things that you're trying to give? And how are you dealing with them? How do you meet them? How do you bring the interest for them to accept what you're giving? In which form? In what ways are you using? And we come the same way to path direction. You say that you meet various people, and I heard about livestock keeping fields and various people in lake areas and interlacustrine areas. You say that we have various people in those areas. We have rural people, but they're mostly scattered. How do you interlink them and connect them? Because if you're giving a service, we can't say you're giving it to minority. We have to give them to majority. Because when you say climate resilience, it's health resilience, and it involves a lot of people. Because if you take action and I don't take action, it means that you're taking on my side, on your side, and my side is affected, and I also need help. So how do you connect those places? And as I say to worth, what time frame do you use to train people? And one last question is that there are people who are resistant in taking what you're trying to give. You may just be giving education, fine, it's an achievement, but still, what do you do with people who are resistant in receiving such services from you? And what measures are you using to reach them? Yeah, that was my question, and I'm really thankful.
Oh, thank you. Thank you very much. I'll pick two more. One there. And the last one here. No. Okay. You'll be the last. Okay.
Good morning, everyone. My name is Generous Oscar, and I'm a public health student from the University of Dar es Salaam. First of all, I'd like to be grateful, say thank you for ADHA for the opportunity to have me here. And also I'd like to commend the panelists very insightful discussion. I do have one question to specifically Dr. Faraj and Dr. Joseph. You have talked about the integration of climate change issues into the health factor, but I have not heard you guys talking about the psychological impacts or integrating mental health impacts in the climate-related outcomes. Kwamba we have the communities ambazo zinakuwa affected by climate change, mtu kama mama ambaye anapenda mpaka kwenye mti, what psychological outcomes do they have, and how have you tried to integrate mental health issues in climate health issues? That is my question. Thank you very much.
Thank you. I hope the speakers are noting their questions. At the back. I think we'll have our last question here, right? Okay, and the very final one there.
Thank you. My name is Zakaria. Thank you so much for the insightful session. My two questions the first one goes to Dr. Faraja. Thank you so much, our dear endocrinologist and the public health specialist, of course. I got one question, a very minor one. So what's your comment here on actually how climate change affects the non-communicable diseases? Maybe you can give an example, maybe a case scenario of the diabetes and all that. Maybe any kind of non-communicable diseases, the integration of this. Another question goes to my dear brother, Dr. Joseph, our senior country director, Pathfinder. I got one very small question. So, as a very senior person in these NGOs, what is the role that partnership between the NGOs and the government actually plays in scaling up the climate and the health interventions? Thank you.
Thank you. We have one. Please only spend like 15 to 30 seconds, and then I'll have last one here. Isaac, first. There. Isaac, this line first, and then we'll finalize it.
Thank you so much for giving me the chance to be here. It was a very thought-provoking session. So my question is, given that low-income countries still have substantial forest cover and natural ecosystems, why is there so much focus on climate interventions here instead of prioritizing mitigation in high-income countries that choose plastic more significantly and cause more global emissions affecting health more than our setting? That's my question. It's not directed to anybody, so anybody can answer.
All right, thank you very much. Last one here. Yeah, past a few minutes.
Good morning, everyone. My name is Mary. I work with Faith Africa, Tanzania. And my question is going directly to the country director of Pathfinder. We have seen that most of the initiatives that we start are being supported by the projects that we are doing. And once the project comes to an end, some of these initiatives ends too. So I just want to know the sustainability of what you have started as climate smart behaviors that you have mentioned. So if we have installed solar powers to the facilities, how do these people maintain them beyond the project lifetime? Whatever the smart climate smart behaviors that we have inserted to the people, to the community, what are the sustainability plans to make sure that these behaviors, they are being maintained beyond the life of the project? Thank you.
Thank you very much. Thank you very much for your contribution. Question. I will now turn to our panelists to respond very briefly, maybe for 2 minutes, if possible, even one. So that we have a few contributions from our partners, and then we'll wind up.
Okay, so looks like I have a lot of questions, but about the challenges we are facing as a recycling, I would like to answer this in a business perspective, because we had this an idea of recycling plastic waste into eco-friendly building material, and this is a business. Though we are addressing the environment issues, but this is a business for us, because the eco brick that we are making, we are selling it and people can use it. So first of the challenges that we have been facing as a startup was regulatory. looks like the regulatory system is much complicated. If you have an idea and you want to register it, there is a lot of complication. So this makes most of young innovators to give up from what they want to do. So I think if there is a government stakeholder in the room, please make sure that you assist youth in which have an ideas to make sure that they are not giving up from where we are because of this complication of regulatory. But also another challenge is operation, like there is no specific machine of turning plastic waste into eco-friendly building material. So it looks like we have to put more effort on innovating on the machine to make sure that we come back with the good and quality product so as we can be able to sell it. And lastly is the awareness. Most of the people, they don't have awareness. Finally, we have this eco brick and we want to sell, but is people trusting your product? Is people have awareness on recycling, like plastic can be a brick, so I can build or can use it to pavement. So sometimes it's quite hard to sell our product because people have lack of trust. Though our brick have been tested that they are durable compared to concrete brick, our brick can sustain in wet areas, but it's somehow hard to make people believe on your product. But the second challenge is like, how are we going to conduct training? So we had this 3 months training to these women, and we conduct a community assessment partnering with local government. So first we communicate with local government, like we have this project and we want to reach like 50 women in your area. So we conduct a community assessment to find the most audience that we want, and we are targeting women and youth 18 to 35 years old. And we have a hub where these women and youth learn practically how to sort waste, but also how to change the waste into opportunity. For instance, we have this glass waste where they turn glass waste into decoration. We have most of glass waste, those wine bottles have been decorated to flag of different countries or any words that can be used in home. And also I've said about this training is consists of many perspectives. We are training them to sort waste, we are training them to see the opportunity of waste, but also we have this training them about the health and safety while engaging themselves in plastic, while engaging themselves in waste management. So these waste pickers, like the women that we're working with, have facing many challenges. Like you may find they have collecting bottles that have liquid which may be harm to them, but also the waste pickers, during the process of picking bottles in the street, they may find this chupa and everything that may harm them. So during the training, we're also training them about the safety, but also how they can be able to protect their health while promoting their lives. I think I've answered that.
Thank you.
Thank you. I'll go quickly to a few questions. Psychological, mental health, and NCD, I will address them together. First of all, thank you very much. I would have been surprised if youth in this group would not have asked about mental health, because I'm sure you are one of the vulnerable population. When you see and you will be worried. In the study that we are leading, we have included what we call eco-anxiety tool there, and preliminary results that I will present tomorrow in our forum. It's called Kished Forum. If you have time, you will attend. We have seen how people are really worried, and it's real. So mental health is crucial, and we will think that people are not worried, but when we ask these questions, some of them are saying even almost every day they worry about what will happen in the next year and the next year. So mental health issues are core and are very central to what we are doing when we are addressing climate change. And we are also on a healthcare sector aspect. We are following, for example, people who have gone through these events. For example, was it Manyara, I think, the landslides. Because we don't know. Once you have built houses, you have settled the acute phase, you don't know what is happening to those who experienced firsthand the effects of whatever happened. In terms of NCD, examples, there are many, but I'll give you the direct example. For example, chronic kidney disease is one of the things that we are looking at. Again, tomorrow we'll be presenting some of the preliminary data of the study that we are doing among agricultural workers, looking at heat exposure
and the risk of developing chronic kidney disease. But there are so many other, including diabetes that you have mentioned. Some of my colleagues in Senegal are looking into how this one also affects. And there are so many others. In maternal health, it has been studied a lot, premature delivery, and so many other conditions that are directly related to direct effects of climate change. And then there are indirect effects. For example, access to care when you have floods, or malnutrition. These are indirect pathways as well. I wanted to mention one thing in relation to community. I'm working with LEAD Foundation. It's a local NGO in Dodoma. And what we have been doing with the community when we are promoting climate smart agriculture and other nature-based solutions, including rainwater harvesting, especially in pastoralist area, is to make sure that whatever interventions you are doing, you embed them within the government system. Here I'm trying to address the question that was raised in relation to sustainability. It should not be a standalone project which will end in 3 years. But while you have the project, you have to make sure that it is embedded within the government system, so that they put it in their monitoring and evaluation. The officers that are responsible, whether they are agricultural extension officers or other wale wanaitwa maendeleo ya jamii, they are involved, they are part of it. When you go to do monitoring and evaluation during the project time, because you have the funds, you go with them so that they know about the project, they know how you do your monitoring, and you ensure that they put it as part of their regular activities. Now, once you are away, you have to make sure that they own as their project, and it's not an organization's project. So when we introduce our projects, that's the very first thing we say. This is the project you are just supporting, but they have to own it. At the end of the day, they say, this is our project. And then you make sure you have regular feedbacks, but before you wrap up the project, it is already embedded within the government system so that they can make follow-up afterwards. Thank you.
Thank you. Thank you. Thank you so much. I also received a few questions. Before I start to the questions, Dr. Mzige, shikamo. Yeah, at least I also have someone I can say shikamo to in the forum. Dr. Mzige, I wanted to remind you something. You may not remember, when you are young, like most of the people here in the room, traveling is one of the dreams. Yeah? Young people like traveling. So when I was a young medical doctor, I happened to be in a meeting with Dr. Mzige. It was a meeting in Iringa about, I think, expanded immunization program, EPI. Sasa, nikachungulia kwenye diary yake. So I was sitting near him, so I was able to peep into his diary when he was opening his diary. So he had a lot of travels, aligned for him. I will be in Bangkok in October. I will be in New York in September. I will be in, so I was very excited, and nilimwonea wivu sana kwamba dokta anapata nafasi ya kusafiri, na mimi napenda nikiwa mkubwa niweze kusafiri kama Dr. Mzige. So dokta, nashukuru sana. Hiyo diary yako ilinifungulia milango na mimi nimekuwa nikisafiri kidogo. So nashukuru sana. So I wanted to say something. We started talking about climate and health more than 12 years ago, as I said at the beginning. And we have been learning every single day. This morning I just came from one of the global, the Green GCF, the Green Climate Fund meeting in Addis Ababa. I just arrived this morning. And one of the main issues which we were discussing in that meeting was around climate and health. And one of the things which excited me more than anything else is the things which we were doing in 2010 as a trial and error at Pathfinder. They are now which are being presented as a gold standard for climate and health interventions, at the global stage. So don't be worried, start from where you are, learn, make some mistakes, but you will contribute to global knowledge kidogo as you go along. So that was the biggest excitement for me being in that meeting. So smart behaviors, you're asking that question. What you said is correct. These smart behaviors change from one area to the other. So co-creation with the local communities, with the government in those particular area is a fundamental thing when we are designing and implementing, community-based climate resilience programs. I can cite you an example. When you go kule kwetu Umasaini, in the Masai land, we the Maasais, we like keeping cattle. And when we have our cattle, we build a fence around that area. We call it a boma, isn't it? Now, in the Maasai land, one of the climate smart actions we have been promoting is telling them kwamba lile boma unapolijenga, tumia miti ambayo ukichimba chini kwenye ardhi inafanya nini? Inaota. So build that boma by using trees, which when you dig them into the ground, they can germinate again. And then we don't call it a boma, we call it a live boma. Kwa hiyo akichimba ule mti, baadaye ule mti unaota. Kwa hiyo hana ile pressure ya kujenga tena boma jingine hivi karibuni, kwa sababu ile boma linamtosheleza, lakini ile miti inamletea na kivuli, wanaona kwenye mazingira yake ya nyumbani. Kwa hiyo ana contribute to sequestration ya carbon. Kwa hiyo those are the kind of context specific, climate smart behaviors which we have to design. If I go to Bukoba and tell them about live boma, it doesn't mean anything for them because they don't keep cattle in boma. So that is one of the examples I can cite here. Yeah, so we talked about the geopolitics, which are happening. We saw the Western countries pushing back on climate. They want to continue, polluting because it is driving the economy. It's a big struggle. At the global stage, it's a very, very big struggle. There is a lot of negotiations happening at different levels, and that's why we from this part of the world, like in the African countries, because we don't emit, our carbon footprint at a global level is very, very small, less than 4%, So that's why we focus mainly on adaptation, because whether we agree or not, we will face the consequences of what is happening in China, what is happening in Europe, and so on, as far as industrialization is concerned. So it's a complicated issue, but there are high-level negotiations happening at COP, happening at those global stages. But the beautiful thing of doing integrated programs, there are usually some resources which may be targeted to something which may not necessarily sound like a climate issue, but it contributes to resilience against climate change. So for example, you can have a healthcare financing program. Healthcare financing is very critical, when there are disease outbreaks which are triggered by climate change. If you can finance your medical services, then you become resilient against that thing. So use different avenues to generate resources for your climate resilience activities. Kuna watu wengine, they don't even know that this is focusing on climate resilience. They look at it as food security. Some people will look at it as water and sanitation. Some people will look at it as solarization, but in a way, it is building your resilience against climate change. Doctor talked about mental health. I will not repeat it. She also talked about partnership with the government. I will not repeat, but I just want to add one more thing that, the government also has plans already, which I've already signed off. There is a national adaptation plan. There are nationally determined contributors. You have to take into consideration everything when you are designing those programs. Yeah, so maybe the last thing I should talk about is how do we sustain those actions at the community level when the project ends. That was a question from one of my colleagues from this time. That is a very good question. Again, climate smart actions, climate smart actions are not different from other actions we have been promoting, So the same principles of building sustainability around the program should apply to climate action programs as well. But also building systems like, for example, if you build in income generation activities which are environmentally friendly, that will give them money to buy a new solar panel when what they have today gets broken. Similarly, at the health facilities level, make sure that you are integrated with whatever the government is doing there. To finalize, I just want to say, there are different entry points you can use to implement climate resilient activities at different levels. I suggest that you look at women as your best entry point. By empowering women, you empower communities. Thank you.
What a way to wrap up that session. I'm very sorry I'm not a very good timekeeper. Unfortunately, we passed time. And as I said, we are joined here with a number of partners. We have IOM, Save the Children, AMREF, I'm not sure if Women Fund is in the room, UNDP. Okay, so I'll call on to our partners to share their very brief reflections of the session and their commitment to climate and health, and particularly what Dr. Joseph just concluded, looking at women as entry point. I'll also add looking at youth as an entry point. You are welcome to the stage, and I'll start with IOM.
Good morning, colleagues. Thank you, and thank you for this opportunity on behalf of IOM. My name is Valda Chari. I'm a project assistant and associate communication officer. So with the reflection of what our dear colleagues has articulated out, at the IOM level, we have multiple initiatives which we are doing under the climate and the health issues. One, we do the MHPSS, mental health and psychological supports, which we have been implementing with the Ministry of Health, and it has become a very outcome-led initiative to ensure that the marginalized communities, people along the border communities, being informed and get health services ensuring when during the disaster happens. And apart from that, at the IOM strategy of 2022-2027, we are implementing the project under the Lake Tanganyika Basin with the IOM Burundi to ensure that different ministerial level at the country level are key member on developing the action plans towards the proper ways of engaging communities on how they can be able to handle climate issues and disaster risk adaptation measures around their community levels. So we have an initiative which is going on currently, and we are working with different ministerial levels. Ministry of Health, we are working with the Prime Minister Office, the Disaster Management Department on the initiatives, and currently we are supporting the government of Tanzania to be the member and participating on the Kampala Declaration, Migration, Environmental and Climate Change, of which initially we had validation workshop or meeting to come out with the joint action plan and policy formulation to ensure that Tanzania is taking part and lead on the climate issues and health major issues. So in summary, I would conclude that as part of IOM and contributing to the health and disaster issues in Tanzania and other various implementers and partners, we must integrate climate action and migration governance and health securities to build a resilient society, and urgent collaboration action is needed to protect vulnerable communities from climate impacting vulnerable issues, and ensuring that the voices of the affected communities, especially women, young children and youth, are being heard and a common central developing solution. And thank you, and I humbly submit.
Thank you very much, Save the Children. So I know it's break time, but we'll spend a few minutes just to finalize this.
Okay. Yeah, good morning, colleagues. Yeah, so my name is Dr. Victor Minja. I work with Save the Children. I'm the Technical Operations Lead on Climate, Health, and Humanitarian. Yeah, so my reflections on this event is quite pertinent, and it supports the greater stream of work that we all as partners are contributing to ensure that the effects of climate change are mitigated. Yeah, so to begin with, I would like us to all close our eyes. I would like us, no cheating, all of us close our eyes. Yeah, so I want to begin with an image. Imagine you are 10 years old, you are walking to school in Hanang district, suddenly the ground beneath you shifts, the mudslides roll down the hills. By the time you arrive, your classroom is gone. This is what Tanzanian children lived through in December 2023. Now imagine another child in Manyara. The rains do not come, the crops fail, their parents struggle to put food on the table. They go to school hungry, unable to concentrate, wondering if education is still worth the effort when survival feels more urgent. This is climate change seen through a child's eye. You can open your eyes now. And here is what research that children born in 2020 will on average face between 2 to 7 times more extreme climate events than their grandparents. They will endure 2.6 times more droughts, 2.8 times more floods unless global ambition rises. So when we speak about urgency, it's not about 2050, it's about the lives of children who are already here today. These children did not create the crisis, yet they are paying the highest price, which is why I say climate change is not an environmental crisis, it's a child's rights crisis. But there's hope because children are not only enduring the climate crisis, they are leading the response. And this year, with the support of Save the Children, they proved it. So earlier this year, children sat down with the Ministry of Health through Save the Children support to review the draft Health National Adaptation Plan for 2025 to 2030. So for the first time ever, the voices were not on the sidelines, but at the center of national policy conversation. They asked for safe water in schools so that children will not have to choose between thirst and education. They called for health services that are ready for climate shocks, clinics that can withstand floods, doctors trained to treat climate-related diseases, and psychosocial support for children who live through disasters. They even demanded disaster-ready shelters, safe spaces where children can find protection when floods, storms, and heat waves hit. These demands were bold, practical, and rooted in lived experience. And most importantly, they were heard. Their priorities are now guiding how Tanzania as a nation prepares its health system for a changing climate. And there's even more progress to celebrate. Just this month alone, our collective advocacy helped secure a historic milestone. Education has now been adopted as a 13th priority focus within Tanzania's nationally determined contribution for 2025 to 2030. This is not just a policy victory, it's a recognition that education must stand at the center of climate action. And this draft NDC now commits to strengthening capacity of schools, training institutions for adaptation and resilience, investing in climate resilient infrastructure to ensure safe and continuous learning. Okay, so at the same time, we've also been at the forefront of multi-sectoral emergency responses to climate-related disasters. So following the Hanang mudslides in 2023, we provided psychosocial first aid for children, established child-friendly spaces, and supported cholera prevention. In the wake of El Nino flooding in Rufiji and Kibiti, and later Cyclone Hidaya and Kiewa, we distributed learning materials, hygiene kits, mosquito nets, and water tanks to keep children safe and learning. Okay, so Tanzania is also leading. Together with the Prime Minister's Office and the Tanzania Meteorological Authority, Save the Children called out the creation of the country's first El Nino contingency and anticipatory action plan, but also supported the National Drought Contingency Plan. These are not just documents, ultimately they are safety nets designed before disaster strike to protect children and families. So let me leave you with this challenge. Do not think of yourselves as the leaders of tomorrow. You are the leaders of today. Your role is not to wait for permission. Your role is to shape solutions, claim space, and carry out your demands to every platform from every village councils all the way to COP30. Because if it is not child safe, it is not climate safe. Yeah. So in this regard, I would like to end this. Asanteni sana. Thank you.
Asante sana. We have two more final remarks from Amref and our host, THS. So Amref and then THS.
Good morning once again. Thank you very much, Alois and AHD team, for giving us this opportunity. Just standing here on behalf of Dr. Florence Temu, who she has got an emergency, but she was supposed to be here today. So I'll be very quick and very brief to just concur on what the forum has just concluded here, that there is really climate change and health is really an important issue, and Amref Health Africa, we are not behind. We are also having initiatives which are supporting the issue of climate change and health. So just briefly, Amref Health Africa in Tanzania is actively tackling the climate change impact on health through innovative programs that combine sustainability, health, and gender inclusivity. In our 80-year strategy that ends in 2030, we have included wash and climate change as one of the programs that we are supporting to make sure that we are supporting the issues of climate change and health. So we have some few initiatives that Amref is conducting in order to tackle the issue of climate change and health, but I'll mention very few. One initiative is briquette production, which is not far from my young sister there who has already elaborated before. We are working with women and youth to produce briquettes. The briquettes, these are alternative source of energy. They really work like charcoals, but they are not charcoal. They are energy efficient source of energy, which can be used in the normal majumbani, kupikia chakula, kupikia chips mtaani. That kind of source of energy can be used. So we're working with these women and young people to capacitate them on how to produce these briquettes and sell. So eventually, it gives them the financial benefit, but also it gives it works on return to work on the issues of climate change protection. So another initiative is smart energy installation to health facilities. This initiative aims to improve maternal health outcomes in installing smart energy solution in health facilities. Another initiative is small-scale farming for nutritional food, whereby we train the community health workers to support the communities on farming, on having the small farming in their communities in order to produce the nutritional food for the children. So these are just few to mention, but Amref is conducting a lot of initiatives in order to address the issues of climate change and health. Thank you very much, and we all have to be the good ambassadors to make sure our climate change and health issues are being tackled effectively. Thank you.
Thank you very much. As THS comes on the stage, I would just like to remind you there's a forum on health financing by Pathfinder. It will be happening at Ruaha Hall from 12:30 p.m. You are all welcome to participate. And if you have more questions for our speakers, feel free to reach out to them or through AHD, and we'll address the key questions. We'll have the remarks from THS, our host, what's their commitment in this agenda, and finally the closing remarks from representative from AHD Board of Directors, if she's ready to close the forum. Over to you.
Okay, thank you so much, Alois and AHDA team. This is really very challenging to close while I'm supposed to keep time. I know we're out of time and I won't take a lot of time. Okay, but thank you so much. We at Tanzania Summit, we remain committed on championing the agenda of climate health. And specifically for this summit, we we have two special forums on climate health. We have the first one, we have the next one tomorrow evening, Kishade. All these showcase that how Tanzania Summit is championing the climate health agenda. And we remain committed to put it on top of our agendas, not just in terms of forum, but also how do we drive the meaningful conversation to translate what climate health means to policymakers, to the communities, to researchers, and to everyone who must be responsible to make sure that we protect our planet. Second, what I'm very impressed about is the engagement of young people. Maria, asante sana. Thank you so much. Nelson, there was a certain lady. Naita nane ndugu? Isma? What? I cannot all these are young people, and they just represent a very few % of young people who are driving the real actions on the ground. We at Tanzania Summit, we have been engaging young people, and one of our strategies to engage as more young people as much as we can, not just through our youth capacity building program that trains and create the innovative and transformative young people to drive the next health agenda, but putting them at the forefront to drive more innovation through our Chair Innovation Award. So, Maria, we really hope to support you, and we are very happy that we have the good number of young people in this room, not just as observers, but showcasing how they are driving climate action in various ways. And we'll be happy to continue supporting the young people. Lastly, Alois, we have the special award and certificate that will be handled by Madam Arisi, the country director, Japaigo. I don't know if she's in the room. Yes, Karim Sana.
As she comes to the stage, I'll just ask the representative of AHD Board of Directors to come at the stage to receive the award with Dr. Maria, and then she'll close for us.
Yes, Karim Sana and Alois and the board director.
Who is in the room? Oh, yeah.
Yes.
Dr. Maria, you can join now.
Okay.
She's coming also to join you.
Okay, asanteni sana na Mungu awabariki.
Okay, thank you. Thank you so much. And thank you for everyone taking your time being here and an extra time we took for all the engagement and the good topics that were discussed. And we really thank our speakers because there were really stories from the community health worker, and then we're having all the recycling and how women are being engaged, to the two main things about the adaptation and mitigation that were discussed from the member from the National Muhimbili National Hospital, and also from PATH. So this calls to action for all of us to really see how we can collaborate in different sectors, as how it was being discussed. It doesn't have to be only one sector. We have to do it all the globally, in a globally way, and also for us to really champion in the youth and women and the community to really do this, to take actions into having all these smart solutions that were being discussed, but also involve everyone in these mitigations and adaptations solutions that will help us in ensuring that we are having the climate related solutions that we can have good health for all of us and for everyone. So I would take this opportunity to thank you everyone for being here, and let us engage, collaborate as we have all these solutions together. Thank you.
Thank you, asanteni sana. I would like now to allow my panelists to stand for a group photo. It can be joined by the partners as well. Asanteni sana for participating. Thanks for the questions, for the insights. You can keep more comments on the registration form. There's an open question. If you have more comments, more questions, you can ask through that as well. But also you can go through our social media pages to comment or suggest any ideas that you have that you think can be brought into the advocacy space for climate and health, but also in the community actions. Thank you very much, and enjoy your breakfast that we have already spent it for the last 18 minutes. Asanteni. You can stand here.
And as we are moving out of this room, if you have dropped some money, kama umedondosha pesa, tafadhali nione.